My name's Laura Hindenburg, and I'm the nurse coordinator for the Inova Children's Hospital Craniofacial program. The Craniofacial program offers a multidisciplinary team approach to care, which means our team is made up of many different specialists who work together to make sure your child receives excellent care through every stage of treatment. Our craniofacial team is recognized as an approved cleft and craniofacial team by the ACPA Commission on Approval of Teams. This means we have met the strict team care standards as defined by the association's parameters of care. Here is a list of some of the conditions we treat. More information on each of these can be found here on our website. You might be wondering, when is the best time to reach out to the craniofacial team if I think my child will benefit from their services? Actually, some of the specialists on the team can be involved even before a child is born. Prenatal ultrasound can detect conditions like cleft lip, and so the most ideal time to see us is soon after the condition is identified. Prenatal consultation provides the team's nurse and craniofacial surgeon a unique opportunity to meet with parents and teach them about the condition and what to expect even before their baby is born. We also offer pre-adoption consults. Parents can meet with our specialists to learn more about their prospective child's condition and potential healthcare needs. Sometimes a family may not have a lot of time to research a particular diagnosis, so we can provide that information and help families to feel better prepared to make an informed decision. We offer post-adoption evaluation and treatment as well. A child's face continues to grow until the late teen years or early 20s. For this reason, we offer yearly teen visits so we can monitor their progress and address any questions or concerns in a timely fashion. Our overall goal is to make sure parents are well prepared for the birth of their child. We also want to let them know that they are not alone and that we are here to help them every step of the way. Now let's look at the role of each specialist on our team. You can also find more information about our team members on the website. Craniofacial surgeons are specially trained plastic and reconstructive surgeons. They are skilled and experienced in the surgical care of children with anomalies of their head or face. Our craniofacial surgeons work closely with other team members to create a treatment plan that best meets the unique needs of each child. They perform surgery that aims to restore function and form and obtain the best aesthetic result possible. Pediatric neurosurgeons are surgeons who specialize in diagnosing and treating children who are born with or had an injury to the brain, spine, or nerves. The pediatric neurosurgeon works with the craniofacial surgeon to plan and perform reconstructive procedures of the skull. Orthodontists are experts in correcting misaligned teeth and jaws. They monitor a child's dental and skeletal growth and development and will use braces, headgear, face masks, and retainers to prevent or treat malocclusions, dental crowding, and jaw discrepancies. They help prepare older children for surgery on the gum line and jaw. The orthodontist also prepares infants born with cleft lip and/or palate for surgery using pre-surgical orthopedics or nasoalveolar molding. The orthodontist's goal is to create a beautiful smile. A pediatric dentist specializes in the oral health care of children from infancy through the teenage years. Pediatric dentists offer education on how to maintain good oral hygiene and prevention of disease. When necessary, they perform dental restorations. Pediatric dentists can provide information on how a child's diagnosis may impact dental development. Oral maxillofacial surgeons evaluate and treat skeletal anomalies of the upper and lower jaw. They remove extra teeth or teeth lost to decay. The oral surgeons can repair gum defects and perform prosthetic implants. Speech and language pathologists wear many hats on a craniofacial team. Once feeding is established, the speech pathologist will monitor speech and language development through the teenage years. Children with craniofacial anomalies may be at risk for speech and language delays or disorders. The speech-language pathologist evaluates a child's articulation, resonance, and language skills to determine if communication and development are age-appropriate. They identify areas of concern related to palatal function and make recommendations for appropriate follow-up assessment, treatment, or speech therapy, and they serve as a resource to community-based practitioners. The speech pathologist provides information that helps other team members plan their surgical and dental management, and often the success of those treatments is measured by the child's outcomes in speech and language. The Otolaryngologist is a doctor who specializes in the care of the ear, nose, and throat. Children with craniofacial conditions may have a higher frequency of ear disease, ear malformations, and upper airway issues. The ENT will follow children routinely over the course of many years to identify and address any issues that arise. Children born with craniofacial anomalies may also have anomalies of the hearing structures, which puts them at risk for hearing disorders and hearing loss. Hearing is important for speech and language development, communication, learning, socializing, and so many other activities. The audiologist can provide information about hearing, discuss results of testing, and offer follow-up recommendations to promote optimal hearing. The genetic counselor discusses follow-up tests that may help to identify a diagnosis, determine the cause of the condition, and potential for associated syndromes. Counselors also provide recurrence risk counseling. Initial genetic screening and routine follow-up are recommended because sometimes important clinical findings may not be apparent in the first few years of life. Pediatric Psychologist plays an important role in assessing how children and family members are doing from a psychosocial standpoint. While some assessment is related to the medical diagnosis and/or medical interventions, they also assess general health behaviors and any problems that might interfere with general well-being. Recommendations are often made in the areas of cognitive and social development, learning, self-concept, and emotional well-being. Pediatric psychologists can help identify community resources and provide counseling or other assistance as needed. The coordinator is the point of contact with the craniofacial team and is a liaison between the team, parents, primary care provider, and other community-based professionals involved in the child's care. At Inova Children's Hospital, we have a team of certified child life specialists who are trained in explaining the medical experience to children of all ages. They will help a child feel comfortable with the care plan and understand what is happening. They are available throughout the process of hospitalization to make each step of the way go smoothly. The entire team is here to support you, your child, and your family through every phase of treatment. Please feel free to contact us if you have any questions or need assistance.